How can you make sure she is getting enough of your milk? Let's call this C for calories. For most protection, babies take frequent small feedings of early milk before your supply increases. Early weight loss is normal and will be followed in the hospital. Weight gain and bright yellow breast milk poops should be expected by day 5. You can never breastfeed too often. If she still needs more, even after you've nursed her well, she will show you by continuing to suck even after you've taken her off the breast or put her down. Don't worry, you can help her. To prevent more than normal weight loss or jaundice, or just to make her a bit more content, either feed her again or finish the feed with dessert from a spoon. Feed her until she is perfectly content. This simple remedy will not interfere with her breastfeeding and will give her more milk and signal your breast to make more milk. The more frequent, the better. Once your supply increases, she will take all she needs while breastfeeding.
Yeah.
The truth is, if your baby's not a strong breastfeeder from the first hours, you and your partner have all you need and are in the best position to begin using your hands to take care of her, just as naturally as you will do throughout her life. Begin soon after delivery, so she gets your first milk now, and you will make plenty of milk in the future. Cesarean-born babies, small and early babies, and babies who are separated from their mothers especially need your helping hands. A cesarean-born baby placed skin to skin on her mother's chest in the operating room may need longer than the first hour before she is ready to feed. Be patient and follow her cues. For some babies, gentle touching and guidance from you or your partner may help. Likewise, small and early babies, those weighing less than 6 pounds, or those born before 37 weeks, tend to be sleepy babies at first, almost too good.
Keep going. So she keeps falling asleep.
Come on, Riley Bear.
They usually wake up, so to speak, and become strong breastfeeders once your milk increases and flows easily. Until your baby, who is not a strong breastfeeder initially, becomes a dependable nurser, pay attention to 2 things: boosting your milk production and offering her your milk. Simply start early and hand express frequently, even just tiny drops, and finish breastfeeding with your milk from a spoon. Breastfeeding your early baby or your cesarean baby is much like growing a garden. With your hands, cultivate a rich supply of milk for her, and as she thrives, she will blossom into a natural breastfeeder. One last thing. Sometimes things don't go exactly as you had hoped for. For mothers who are separated from their babies or have problems with attachment, this first hour matters the most. Remember, the critical signal to your breast to make lots of milk later on is to remove milk early and frequently. Your partner can help you get started. Push down and relax. Isn't that beautiful? Now, Shelley, show us how you do it on this side.
Okay.
Remember? Because the hormones of delivery make hand expression easiest during this hour, the signal is very strong. Another pair of helpful hands can be really valuable. Use your hands and do just what your baby would do. Remove the precious small amounts of milk from each breast. The more frequent, the better. Alternate right breast for a minute, then left, then back to right, and so on. Use the same press, compress, relax technique. Don't worry about collecting every drop, because the more milk out in the first hour, the more milk in as milk increases. A small towel with the extra drops can be placed beside your baby's face as a calming reminder of you. Whatever milk you do manage to collect, ask to have this given to your baby as soon as possible. Keep expressing every 2 to 3 hours. This is how you place your order for a good milk supply in the future when your baby is ready to breastfeed. Of course, you can't know exactly how your own delivery will go, but one thing is for sure. Simply by using your hands in the first hour, you can accomplish these 3 goals. A. Attachment. Help your baby with a comfortable and effective latch. B. Breast milk production. Signal your breast to make plenty of milk under any circumstances. And C. Calories. Make sure your baby receives that first milk when it comes most easily. Understanding just these points is pretty simple and exactly what matters most from the very first hour.